If your dog suddenly stops eating food or drinking water, do not brush it off as a small mood change. What seems like a simple skipped meal could actually be one of the earliest warning signs that something is wrong. Dogs are creatures of habit, especially when it comes to food. Most of them know exactly when breakfast is served, when dinner is coming, and where the treat jar is kept. They light up at the sound of a bowl, come running at the crinkle of a packet, and act like every meal is the best moment of the day. So when that same dog turns away from food, ignores treats, avoids water, or seems completely uninterested in eating, it gets your attention fast. And honestly, it should. In today's video, we are going to talk about what it really means when your dog stops eating or drinking, what causes it, what you can do safely at home, and when it is time to stop waiting and call the vet immediately. And before we go any further, if you truly care about keeping your dog healthy, happy, and safe, make sure you subscribe to Canine Care, turn on notifications, and stay with us till the end, because this information could help you catch a serious problem before it becomes an emergency. One of the biggest mistakes dog owners make is assuming that appetite loss is just a phase. Sometimes it is minor, yes. Sometimes a dog skips a meal because of heat, stress, travel, or a slight stomach upset. But other times, refusing food or water is the body's way of sounding an alarm. Dogs cannot explain pain, nausea, weakness, mouth problems, fever, or dehydration with words. Instead, they show it through behavior. They become less excited. They stop running to the bowl. They sniff and walk away. They lie down more. They seem quieter than usual. And in some cases, they may want food but simply cannot eat because chewing or swallowing hurts. That is why the first thing you need to understand is this. When a dog stops eating, it does not always mean they are being picky. It may mean they are uncomfortable, unwell, stressed, in pain, or struggling with something more serious going on inside the body. The first thing you should do is pause and observe. Do not force food into your dog's mouth, and do not panic buy 10 different foods all at once. Watch your dog carefully. Are they still alert and responding normally? Are they following you around, wagging their tail and wanting attention, or do they seem withdrawn, tired, or unusually quiet? Are they drinking any water at all, or are they avoiding the bowl completely? Did they vomit recently? Are they having diarrhea? Are they drooling, licking their lips often, or acting nauseous? Do they seem bloated, restless, shaky, or uncomfortable when moving? Have they been coughing, gagging, or pawing at their mouth? These details matter because appetite loss by itself is one thing, but appetite loss along with vomiting, diarrhea, weakness, dehydration, or pain tells a very different story. Sometimes the cause is surprisingly simple. A change in routine can upset even confident dogs. Moving to a new home, a long trip, a thunderstorm, fireworks, boarding, a new pet in the house, a missing family member, or even a stressful visit to the groomer can be enough to reduce appetite temporarily. Some dogs are emotionally sensitive and stop eating when life feels different. In those cases, they may still seem physically okay overall, but mentally unsettled. They might eat only if you stay near them. They may hesitate at the bowl, take one bite, and walk away. If this sounds like your dog, a calm environment, consistent routine, and a little patience may help. But even then, if refusing food continues too long or water intake drops too much, it still needs attention. In other cases, the problem is physical rather than emotional. Mouth pain is one of the most overlooked causes of appetite loss in dogs. A dog with gum inflammation, loose teeth, a broken tooth, mouth ulcers, or pain in the jaw may still feel hungry, but eating hurts. You may notice them approach the bowl and then stop. They may drop kibble from the mouth, chew only on one side, take longer than usual to eat, or suddenly prefer softer foods. Some dogs paw at the face or have bad breath that seems worse than usual. Owners often describe this as picky behavior, when in reality, it is pain. That is why watching how your dog acts around food is just as important as whether they eat it. Then there is nausea, and nausea can be tricky because many dogs show it in subtle ways. A nauseous dog may stare at food, sniff it and walk away. They may drool, swallow repeatedly, lick their lips, eat grass, or seem restless. Nausea can happen because of stomach upset, dietary indiscretion, infections, medication side effects, kidney issues, liver problems, toxins, intestinal inflammation, or even a blockage. If your dog is not eating and also seems queasy, do not assume the answer is just to tempt them with tastier food. Sometimes the stomach needs medical help before appetite can return. Water refusal raises the concern even more. A dog can go without food longer than they can go without hydration, especially if they are already losing fluids through vomiting or diarrhea. Dehydration can develop faster than many owners realize, and once it does, your dog may become even weaker, more nauseous, and less willing to eat or drink. That creates a dangerous cycle. So if your dog is not drinking much, start watching hydration very closely. Check the gums if you can. Healthy gums should feel moist, not dry or sticky. Look at the eyes. Sunken-looking eyes, tired appearance, weakness, or unusual lethargy can all be signs that your dog may be drying out. If your dog is refusing water completely, acting weak, or unable to keep fluids down, that is not something to watch for too long at home. Now let us talk about what you can do safely when your dog has stopped eating. One of the best first steps is to make food more appealing without making it risky. Dogs often respond better to foods with stronger smell and softer texture when they are not feeling well. Slightly warming food can make a big difference because warmth boosts aroma, and aroma can stimulate interest. You can try offering a small amount of warmed wet dog food or a bland, plain meal such as unseasoned boiled chicken shredded into tiny pieces. Soft food is often easier for dogs with mouth pain, sore throats, or mild nausea. If your dog normally eats dry kibble, you can soften it with warm water. This changes both the smell and the texture and may make the meal easier to accept. You can also try adding a little moisture to the meal using a dog-safe, low-sodium broth, but you have to be careful. Many broths made for humans contain onion, garlic, excessive salt, or other ingredients dogs should not have. That is especially important to remember when your dog is already unwell. Keep it plain, simple, and safe. The goal is not to create a gourmet meal. The goal is to gently encourage eating without upsetting the stomach further. A few spoonfuls of warm, soft, plain food can be more effective than filling the bowl with rich or heavily flavored foods. Another good approach is to feed small amounts instead of full meals. When dogs feel sick, a large portion can seem overwhelming. Put down a tiny amount first. If they eat that and keep it down, you can offer a little more later. Small, frequent portions are often easier for a dog with a delicate stomach than one big meal. Hand feeding can also help in some cases, especially if your dog is anxious, extra clingy, or just needs comfort. Some dogs who refuse the bowl will take a few bites from your hand because your presence reassures them. This does not mean you should turn every meal into hand feeding forever, but when a dog is under the weather, a little gentle encouragement can sometimes get them started. Now let us talk specifically about drinking water. If your dog is not drinking, the first step is to completely refresh the water bowl. Wash it well, refill it with clean water, and place it somewhere easy to access. It sounds basic, but some dogs dislike stale water, dirty bowls, or water that has become warm and unappealing. Others may be uncomfortable bending down if they have joint pain, weakness, or back problems. In that case, a raised bowl may help. Some dogs also prefer drinking from wider bowls or fountains. You can even offer water by hand, with a spoon, or by placing a second bowl in another location. Sometimes the smallest change can encourage them to take a few sips. If your dog is not eating much, switching to wet food for a short time may also help because wet food provides extra moisture. You can add water to food to increase hydration further. A few dogs will lick ice cubes or take a little dog-safe broth when they will not drink from the bowl. But keep this in mind. If your dog drinks and then vomits repeatedly, or seems more uncomfortable each time they try to drink, stop experimenting and contact your vet. At that point, hydration may need to be given medically rather than by mouth. There are also things you should not do. Do not offer onion or garlic-based foods to stimulate appetite. Do not give spicy leftovers, greasy meat, fried food, or random home remedies from the internet. Do not force-feed a dog that is resisting strongly, especially if they are nauseous or having trouble swallowing. And do not keep changing foods every hour hoping one magical option will work. Too many food changes can make stomach upset worse and make it harder to know what is helping. Stay calm, choose safe bland options, and focus on observation. Another important question is timing. How long has it been? A healthy adult dog skipping one meal may not be a crisis if they are otherwise bright, drinking normally, and acting okay. But if your dog has gone a full day without food, you should take it seriously. If they are not drinking as well, concern rises faster. Puppies, seniors, and dogs with health conditions should be seen sooner because they have less room for delay. A diabetic dog, a dog with kidney disease, or a very young puppy can get into trouble much more quickly than a healthy adult. That is why context matters. The same missed meal may mean one thing in one dog and something far more serious in another. Let us also talk about red flags, because this is where owners need clarity. If your dog stops eating and also has repeated vomiting, severe diarrhea, weakness, trembling, pale gums, belly swelling, trouble breathing, collapse, repeated retching, signs of poisoning or obvious pain, do not wait for appetite to come back on its own. Get veterinary help immediately. The same goes for a dog who cannot keep water down, seems severely dehydrated, or looks mentally dull and disconnected. Appetite loss is not the only clue. It is the whole picture that tells you how urgent the situation is. Sometimes the cause lies deeper in conditions such as kidney disease, infection, gastrointestinal inflammation, ulcers, fever, pancreatitis, liver issues, hormonal disease, or even cancer. That is exactly why owners should never assume that appetite loss is just stubbornness. Dogs do not usually refuse food for no reason. Even emotional causes like stress are still real causes. Something is affecting the dog's body, mind, or comfort, and that deserves respect. The earlier you notice patterns, the more helpful you can be to your vet. Keep note of what your dog ate last, when they last drank well, whether vomiting or diarrhea happened, and any recent changes in routine, medication, treats, or environment. A lot of dog owners make the mistake of waiting until the dog looks dramatically sick before taking action. But by the time a dog is weak, dehydrated, and completely refusing everything, the body may already be under a lot of stress. Early action matters. That does not always mean rushing to the emergency clinic after one missed breakfast, but it does mean paying attention, making safe adjustments, and knowing when not to delay. There is a big difference between observing and ignoring. Good owners do not panic, but they also do not pretend everything is fine when the signs say otherwise. If your dog starts eating again, that is a good sign, but it does not mean you should instantly go back to large normal meals. Ease them back in. Offer small portions and see how they respond. Keep meals plain for a little while if stomach upset was suspected. Watch for vomiting, loose stool, bloating, or renewed appetite loss. Make sure water intake improves too, not just food intake. Sometimes dogs will take a few bites and owners feel relieved, only to miss the fact that the dog is still weak, still drinking poorly, or still uncomfortable. Recovery should be steady, not forced. This is also a good reminder that regular observation of your dog's normal habits is one of the best forms of prevention. Know what normal enthusiasm looks like in your dog. Know how much they usually drink, how quickly they eat, how their stool looks, and how they behave around mealtime. The more familiar you are with their routine, the faster you will notice when something changes. Dogs often show illness in small ways before major symptoms appear. Appetite is one of those clues that can help you catch problems early. So if your dog stops eating food or drinking water, your priority should be simple. Stay calm, assess the situation, try safe supportive steps, and do not delay veterinary care when red flags appear. Offer fresh water. Refresh the bowl. Try soft, warm, bland, dog-safe food. Feed small amounts. Make your dog comfortable. Observe carefully. And if your instincts tell you something is wrong, trust that feeling. You know your dog's normal better than anyone. When that normal suddenly changes, it deserves attention. Your dog depends on you not just for food, but for protection, comfort, and timely action. They cannot say, "My mouth hurts," or "My stomach feels awful," or "I am too weak to get to the bowl." They communicate by turning away, slowing down, hiding discomfort, or refusing what they usually love. It is up to us to notice those silent warnings and respond with care. Sometimes the answer is as simple as a mild upset stomach and a bland meal. Sometimes it is dehydration, pain, or a health issue that needs treatment right away. The sooner you recognize the difference, the better you can help your dog recover. And that is exactly why videos like this matter. At Canine Care, our goal is not just to give you random dog tips. It is to help you understand your dog better, respond faster, and become the kind of owner your dog can rely on in the moments that matter most. If this video is helping you so far, take a second right now to support the channel. Like this video, share it with another dog owner, and subscribe to Canine Care so more pet parents can learn how to protect their dogs before small symptoms turn into bigger problems. At the end of the day, a dog refusing food or water is never something to laugh off. It may be mild or it may be serious, but either way, it is meaningful. Mealtime behavior tells you a lot about your dog's physical and emotional state. A happy eater that suddenly becomes uninterested is giving you a clue. A thirsty dog that suddenly avoids water is giving you another. The best response is not fear. It is awareness, patience, and smart action. So remember this. If your dog stops eating, look at the whole dog, not just the bowl. If your dog stops drinking, think about hydration, not just appetite. If your dog seems painful, weak, bloated, nauseous, or unusually quiet, do not waste time hoping it will magically pass. Safe home care can help in mild cases, but serious signs need professional attention. Trust observation, trust timing, trust your instincts, and most of all, trust that acting early is one of the best gifts you can give your dog. If you found this video useful, please give it a thumbs up, share it with friends, family, and fellow dog lovers, and subscribe to Canine Care for more trusted advice on dog health, behavior, grooming, feeding, and everyday care. Your support helps us create more videos that can make a real difference in the lives of dogs and the people who love them. And if your dog has ever gone through a phase of not eating or drinking, tell us about it in the comments. What signs did you notice first, and what helped your dog recover? We would love to hear your experience. Until next time, keep watching your dog closely, keep learning their signals, and keep giving them the care they deserve. This is Canine Care, where better knowledge leads to better care.